Speakers. We've got a group of speakers coming to speak to you here about community health centres, and maybe if I can invite everyone up. I've got Malcolm Steinberg, Tim Takaro, Agnes Black, and John Calvert. Welcome.
Thank you, Your Worship, and members of Council, and I also acknowledge that we're on the unceded territory of the Coast Salish people. We've come here tonight to speak about an issue that's close to our hearts and which we think is something that is of great interest, hopefully, to people of New Westminster, and that is the possibility of eventually getting a community health care centre established here. Community health care centres are an approach to primary health care that's widespread across the country, and I have a PowerPoint here that I'd like to give you a bit of background on this, some of which you already may know, of course, but basically the main attributes of a community health care centre involve community governance, community engagement, and community accountability. They involve using an interdisciplinary team of healthcare professionals that try and ensure that the services that they provide are integrated and are very broad in scope in terms of the types of professionals involved. Community healthcare centers deal with the whole issue of the social determinants of health. And the wellness and the health of broad communities, as opposed to simply dealing with the issue of treating people after they're already ill. So community healthcare centers deal with issues like prevention, outreach, education in the community, health advocacy, and so forth. And they also are sensitive to the different cultural organizations and groups in communities, First Nations, and all the other varieties of people who are in diverse communities such as New Westminster. And as part of their normal mandate, community healthcare centers are involved as well in what's called capacity building to promote equity, social justice, and the health and well-being of all community members. I've just put together a short slideshow here, but basically these are just some quick pictures of some of the community health center activities around the country. I would say that BC is a bit unique in the sense that we only have one true community health center in this province, namely REACH in East Vancouver. The history of community healthcare centers goes back a long ways. They were started in Saskatchewan around the time of the legislation that province passed to implement the coverage of physician services in Medicare in 1962. And Saskatchewan was one of the leaders in setting up this kind of health service and continues to have a number of community health centers. Quebec established community health centers in the 1970s. And across the country now we see more than 300 community health care centers in provinces all across Canada. So this is just quick screenshots of a couple of them. Saskatoon Community Clinic, Community Health Center in Halifax, North End, Manitoba Association of Community Health Centers, and in Ontario, community health centers have really expanded quite dramatically. The province began supporting them in the early 1970s, but going back about a decade, and around 2005, the provincial government there decided to make a big push to expand the number. And now the province of Ontario fully funds 75 community health centers, plus a number of nurse practitioner centers, and some First Nation centers in addition to that. So the total is 107. And Ontario last year, according to the Auditor General, spent $401 million on community health centers in the province. These are just a couple of screenshots, again, of some documents that deal with the question of the effectiveness and success of community health centers. Particularly, I would note the one on the right, looking at comparison of primary healthcare models in Ontario, a study that strongly supports this model and shows how effective it's been in delivering quality healthcare for the people of those areas which are covered by the community health centers. Community health centers have a lot of different partners, and again, a screenshot showing you some of the different ones that are involved across the country. In terms of BC, I mentioned that BC was lagging behind. The first community health center, and the only one that really meets all the criteria, is REACH, which is in East Vancouver. It started in 1969. For those of you of our age of mine who can remember, there was a 1973 report by Dr. Folks who looked at establishing community health resource boards across the province. Unfortunately, these were dismantled by the Social Credit government after 1975, and REACH was the only remaining one in the province. Later, it did establish Mid-Main, but Mid-Main never had the same governance arrangement as REACH. REACH is characterized by salaried physicians, a multidisciplinary approach with a number of different health professionals. It has a community board that meets all the criteria for a comprehensive CHC. And there's just a screenshot again of the from the REACH website. Some of the services provided by REACH, clinical health care, of course, by physicians, nursing care, dentistry. They have a pharmacy, they do counseling, they have a number of youth programs, they do programs around social work, they have health education in the community, they provide immigrant and refugee services, they have a large multicultural family services center, and they do a lot of work in terms of community outreach. There's REACH just had a reopening of its facility on Commercial Drive, and there's some, the chair of the board and I think our Minister of Health and some others cutting the ribbon for the new building or refurbished building that REACH now has. That was about 2 months ago. Let me go back. If you like, and I'm not sure what our time constraints are, so I'll look for direction from the mayor here, but I have a couple of short videos about REACH itself if you would like me to show them, or we could come back to them later, whatever your direction is.
So I think we've gone about 8 minutes so far, so I think 15, 20 minutes overall, so I'll let you determine how best to use.
Let me just show you one of the two. I think it's about 4 minutes, and I'll give you a flavor of what REACH is like. So it's this one. Double click. No, sorry, I know what you have to do. Go down. Now go back to it. Back to that slide. Double click.
Works would be a modern miracle.
You'll be the first one in New West City Council ever to get a video. Well done.
There. Do we have volume?
Diversity.
Sono.
Dangdang. Resource.
Salud.
Cooperation. REACH is a cooperative of people, of professionals, of administrators from many work sectors that work as a team to try to accomplish something more than the community has offered yet.
It's a hub, a holistic approach for a person's health. It serves the community at large and tries to bring in a multidisciplinary approach to address a person's overall health.
REACH to me is integrated. I think that having all of the services that are at REACH in one building and kind of a one-stop shop is so important for the community. And I think being able to have your dentist talk to your doctor, who talks to your nurse, who talks to your pharmacist is a really powerful model of delivering healthcare.
REACH means social justice in the sense of providing support for people and recognizing the complexities of identities and the struggles people may face, and trying to make sure that people live a better quality of life, and just being advocates for the community and for people who might otherwise be marginalized in various systems. REACH is a place where people can feel that they belong, they feel like they matter, they're being seen, and their concerns that they raise are being acted on and addressed. I think for the community, it's also a safe place for them to share their struggles, to connect with other people who are facing similar struggles, a place for them to just be comfortable and true to themselves and where they're at in their life.
I feel like we're on a journey now that we're in our new place to get in touch with the community again, to develop more programming, to respond to the community needs. So it feels like a journey to me.
REACH means family to me because my daughter, who is now 39 years old, was born in this practice. My 3 grandchildren have all been born in this practice. My wife worked as a receptionist here and was president of the board, and now I'm taking a turn on the elected community board. And our family has never had to think about healthcare because of REACH.
REACH is like a family, both amongst the staff that have been here, many of whom stay for very long periods of time, and also the clients in the community that we serve, because we get very attached to the people and to this community, and it becomes like a big giant family.
So a bit more background very quickly. I know you have other people waiting as well to present to you, so I'll be as quick as I can. But both, as you know, in the last provincial election, both the NDP and the Greens made a commitment to build 20 new community health centres in EC. And this is, as we see it, an important part of the government's primary healthcare reform package. This entails or includes the notions that I indicated at the beginning: interdisciplinary care and community governance, 2 key elements of a community health center. And community health centers, in terms of the research we've seen, for example, in Ontario, have done a good job in reducing the demand on emergency departments because people are able to get more of the services that they really need in the community without having at the last minute to go to emergency for a crisis that could be better handled in a good community health center. It's a quote from the election campaign of the NDP in 2017, talking about team-based care and the importance of that, and referencing the success that they have had in Ontario with this. So issues for the provincial government, I think, given the commitment that's been made, the question is, where will some of these new community health centers be located? We haven't heard yet how many will be actually set up. The number we've heard is 20 from the campaign. And who will take the lead on this in terms of pushing forward this agenda at the local level? We see this potentially as an opportunity for New Westminster. CHCs obviously will have to have financial support from the government, and from Fraser Health, of course. But arguably, they also need a bit of a push from the bottom, from the communities themselves, saying that they see this as a model that would make sense for them. Certainly, strong local interest may be a factor in terms of encouraging the provincial government to say, yes, New Westminster is a good place for us to consider putting in place one of these new centres. That's, I guess, our pitch here. We think this is a great model. We think it has huge potential, and we'd love to entertain any questions you might have about community health centres or primary health care, please.
Okay, well, thank you very much for the presentation. I think it definitely is a very intriguing health model that I think you've demonstrated has had proven successes in other areas. I guess my one question is, you kind of indicated that maybe New West might be up for one of those new locations as a test point. I would think, given that we have a very diverse population and a very diverse demographics in the community, might in itself, lend itself there. But what other characteristics do you think would be a strong point for a municipality to potentially advocate for one of these locations being served in their community?
Well, I'll have a quick go at this, and I'll turn it over to my colleague Malcolm here. My sense is that the municipal governments like yours, you know the community. You know the organizations out there. You also know the needs in the community. And that's so important in terms of conveying to the province that you're in a position to really help with this initiative. So that, I would say, is really key. Malcolm?
Mayor and councillors, thank you again for the opportunity to present. I think we see New West as a council that is strongly committed to community governance and democratic practices, and wishes to be seen to fulfill answering the mandate of the committee and of the community and holding yourself accountable to the community. So that is a critical element of the successful functioning of a community healthcare centre. And the second reason is we are outsiders. So Tim on my right, myself, and John are members of the Faculty of Health Sciences at Simon Fraser University, and we come here with a commitment to partner with you should you choose to venture into this piloting of a community healthcare centre, to establish best evidence and best practices and to evaluate the progress of your venture as you go forward.
Okay, thank you. Councillor McAvoy.
Thank you. Councillor Harper and I are proposing a motion, which Councillor Harper is going to speak to in a moment. But I just have a couple of questions. I was going to ask you to introduce your group so council can know who you all are and what your role is in things. So you kind of alluded to that, but why don't you go ahead? And I believe there's a member of the group who lives in New Westminster. All right, so go ahead, guys.
And spouse of one of the people here whose wife works here as well.
Okay. Oh, okay. Well, fill us in.
I'm Aggie Black. I live just a couple blocks away. I've lived in New West for 12 years. I'm a registered nurse and a healthcare researcher. I work at St. Paul's. So I'm well aware of what happens when there isn't a community health center that meets the needs of people and who ends up in the emergency department whose needs could better be met by an interdisciplinary team at a place like a community health center. And I'd love to see one in New West.
I'm John Calvert, and I teach in the Faculty of Health Sciences at Simon Fraser University.
Malcolm Steinberg, I'm a colleague of John's, teach in the Faculty of Health Sciences at Simon Fraser. And I incorrectly introduced my colleague as an outsider. He's very much an insider.
Hi, I'm Tim Takaro. I'm a physician living here in New West. Thank you very much for having us speak to you about the importance of community health centers. As a physician, I practice at Vancouver General Hospital, but I have a specialty clinic, and I see people from all over the province for occupational medicine problems. And one of the frustrations, even in this most well-endowed clinic at Vancouver General Hospital, is that I can't pull on ancillary care like I should be able to. When I have issues about asthma and housing, I can't ask for a social worker to help someone move to a housing that is more healthy. I have problems finding pharmacare services for some people. And the beauty of the community health center is that physicians are not driven by, well, can I get another procedure charged for this? They are driven by, how can I best deliver care for this patient who's in front of me? And that incentive is very important. I'm sorry to say it's more important than it should be, considering the Hippocratic Oath and what we purport to do as physicians. So I'm really in favor of community health centers in general, and I think New West would be well served by such a clinic, if not several.
And I'd also like to ask you, just to, you know, fill in the whole community and council about some of the conversation we've been able to have. My doctor gets so frustrated with the current model, which is dealing with patients who sometimes have several issues or complex issues in 7-minute visits and reschedulings. And
Sorry, we can only talk about one problem.
Yeah. I hear a lot of doctors say that. So, and my understanding is that the community health clinic model is somewhat different in terms of how it deals with people who have several or complex issues. So can you tell us a little bit about that?
Well, there are two parameters of a community healthcare center that lend itself to responding to that issue. The first is the funding mechanism. Is that in most community healthcare centers, the funding mechanisms are not fee-for-service based, which means that there is no longer an incentive for the physician to drive volume and to increase the flow through the clinic services. And the second is the interdisciplinary practice and the ease of reaching out to colleagues to handle the multiple problems that these complex patients often present.
Thank you.
Okay, thank you. Councillor Trentadue.
Thank you, Worship. Thank you for the presentation this evening. I suspect that this may be a fairly complicated answer, but if you can simplify it, why are there not more CHCs in BC? I know, I mean, I don't need a 3-hour answer. I'm sure that's what you have, but quick and easy for me.
This is something that I'd be foolish to volunteer to try and answer, but I will. I think previous provincial government didn't really see that this was a model that it wanted to pursue. I can't provide all the reasons why that was their view, but they did not provide funding and did not encourage the development of these centres. Whereas, as I indicated in the presentation, we see a huge growth in community health centres in Ontario, for example, where the government has decided that this is an important model. It's not the only model for delivering primary health care, but it is an important model. For whatever reason, the previous provincial governments were not interested in it here.
Thank you. It makes such good sense to me, so I'm interested to see how this plays out in New West. Thank you very much for inviting us to participate.
Thank you. Councillor Puckmeyer.
Thank you. Thank you for coming out, and good answer on why we don't have them today. I agree with you, and there hasn't seemed to be a good lens on the preventative side, and I really see that having a good healthcare system is community health as well. To prevent people going to the hospital, to emergency wards, to a private clinic that makes you come back over and over again, or phones you right out of the blue and says, the doctor needs to see you, and you go there and it's nothing. It's just a routine call. And I think that really hurts our healthcare system and costs our healthcare system. So I'm very pleased with it. I just want to make a couple of observations. There are many nonprofits that have superior healthcare initiatives, such as there's a dentistry in Surrey that our new Westminster resident, mostly in the homeless capacity, and some couple of immigrant cases where we've had to take new immigrants to get emergency help in dentistry that they couldn't afford, and a leading HIV program with the Positive Haven in Surrey. Absolutely groundbreaking work that they've been doing for decades. And so it would be really nice if, and we have a group that came here recently that are being evicted, their rent's getting unbearable, and they're looking for a new place. And they deal a lot with immigration and new immigrants in Canada. So, you know, if this does go forward, do you sort of see you have a model off the shelf, or would you be interested in looking at some of the other organizations that have already done, you know, years of work and have created capacity in those fields? Would you be actually interested in collaborating with some of the stuff we already have?
Well, I think what you're suggesting is just common sense. If people have knowledge of what's happening in the community and the health needs, they would be people that should be worked with in terms of setting up a new center here. You know, there are a lot of different primary health care approaches, and I don't think our position is that this is the only one that could be used to deal with some of the problems that people have, but this is one of the important ones. And my sense is that in establishing a new community health center here, that you would want to reach out to the organizations that already exist to make sure that you're not needlessly duplicating things, but also to see what the needs are in the community that you can fulfill. So, and the community healthcare model is very sort of comprehensive because it's multidisciplinary. REACH, which I mentioned before here in East Vancouver, has, I think, about 44 full-time staff. Many years ago, I moved to BC in 1993. I lived in Ottawa before that, and I was a member of the Centertown Community Health Center at that time. And it had, I think, 105 staff. And when you have that level of staffing, then you can do things like be open fairly late in the evening. You can be open more on weekends because you can rotate the staff in terms of scheduling. You can provide a lot of services that mean that people don't need to go to the ER when they have an emergency health problem. If it's not that serious, they can go to their center. If they need to go to the hospital, the center will tell them that. So REACH is a very small community health center compared with many that are in Ontario. And those in Ontario provide a very wide range of these different services. I mean, Tim mentioned the issue of him needing a social worker, for example, to be able to send one of his patients for that kind of help, or someone to help with housing. These are all important needs that have health repercussions for people. And that's a kind of infrastructure that you can build in a community health center that really addresses these kinds of problems that people have.
I think just to complement what John's saying is that I don't think we should be misinterpreted in suggesting that a community healthcare center pulls in all the community services under one roof, but in fact actually acts as a facilitation mechanism to create a community of practice that creates much better, efficient, more informed and sharing networks throughout the community, so that referral mechanisms, feedback mechanisms, patient information record systems, all of those kinds of things are possible. So that is really the mechanism of addressing the social determinants of health through community healthcare centers.
Councillor Williams.
Yes, thank you. Thank you for coming tonight. Who funds you? Where do you get the money then to operate?
So are you asking, we're faculty members here, so that's how we're funded. But in terms of the community health center,
yes.
REACH is funded by the provincial government, and they funnel money through Coastal Health, and there's a contract between REACH and the Coastal Health, but the money comes from the province, and there's two envelopes for it. Some of the funding for physicians is under the alternate payment program, and the funding for the other health professionals there and the ancillary staff are directly from Coastal Health as part of the contract that they have. So we anticipate that the funding would come from the province.
So you've come here, like, if New Westminster would agree to have such a center, what would be the next step? Then we would have to approach, you would have to approach the provincial government, or how does it work?
Well, there's also Fraser Health as well, which would obviously need to be in the loop on all of this. I mean, this would be a signal to the province that you would like to engage in a discussion with them about setting one up. And there's obviously a lot of work to be done once that happens. But if the signal comes here that you would like to host a center, that would be a major first step, I think.
Okay. Thank you very much.
Part of this response would be holding the government responsible for the 20 community health centers they have promised. We should have at least one.
I agree. Thank you very much.
I think it's important as a council for you to appreciate that while we're making a strong and we believe a logical argument for community healthcare centers, that there are other mechanisms and ideas on the table for primary care reform, namely in the form of primary care networks, which are really physician-dominated solutions, in our view, and may very well have their place in a mixed response to primary care needs in the community. But we believe that without a groundswell to hold the government accountable to its commitments, that the primary care network model might swamp those commitments.
So the time is ripe. Thank you.
Okay, so we have a motion later in our agenda, but I'm thinking now might be an appropriate time to put that forward. And Councillor Harper, I know you put this motion on the agenda.
Yeah, I'm not going to read all the whereases. I'll just read the therefores and motivate it. Basically, where it says, where are we here? Affirms the support for the provincial government's initiative to establish 20 CHCs across the province, directs the UBCM staff to consult with the Ministry of Health and the regional health authorities to develop proposals for implementing this commitment in municipalities wishing to host new CHCs, and requests that the Ministry of Health to support municipal government initiatives to develop full-fledged CHCs, which include a community governance board, the provisions for the interdisciplinary services and community outreach programs that address the social determinants of health. Now, basically, if I can motivate that, Your Worship. For me personally, I've experienced community health. Actually, I experienced it at REACH. I just recalled just a few minutes ago that my youngest son actually was born at a REACH. So we've had a number of years of experience with that model. And I think that the fee-for-service model is quite dramatically different than the existing model which we have in our own private practices here that most of us attend. And people talked about the limitations in which you have when you go to see your doctor, and particularly when you have multiple issues like diabetes, like I have, that affect a whole series of areas. It's oftentimes difficult to get the doctor to actually deal with all the issues you have at that particular appointment. And so I think that the community health model, if you like, is like a one-stop shop. I hate to use that term, but it's one that actually facilitates the total health of the patient. And I think that's what appeals to me most. And the other part that appeals to me most is the governance model, which you haven't talked very much about. Is the governance model is a board that every person who's a patient is a member of the society. So you get to actually decide who your board members are, the kind of programs eventually that will be in that center, stuff that's missing or stuff that's needed, and there's real public input into the way that that health delivery model actually works. So for me, those are the two major pieces, I think that, and as far as our role as a government, we're going to be lobbyists in this matter. Whether we the motion, part of the motion is to take it to the UBCM, to try to convince other cities across the province to take the same model in hand, and so it also to whenever we do, and we meet with ministers of health and we meet with Fraser health officials and a variety of forums, to actually take that message forward and say, New Westminster wants to have a community health care center. And somebody asks me why I want that to happen, I'll say very clearly it's because we're an innovative city, and this is an innovative model. And we're innovating in healthcare all over the place here, particularly with our Idea Center. And this will be a part of that sort of strategy of the city to build an innovative city for the people who live here in New Westminster, and that healthcare center would be a fundamental part of it.
So Councillor Harper, first of all, is there a seconder to the motion? The one suggestion in terms of the motion, it really speaks to the UBCM, which I think is really the next step, and advocating for the provincial government to actually go ahead with their commitments they've made. But the other element in terms of New Westminster being a host, or potentially us, putting our name forward to be a host and maybe even a pilot for this to the provincial government, that might need an additional amendment on top of that, or a separate motion that can be dealt with separately from the UBCM motion. Councillor McAvoy, you look like you had a solution to that.
I want to speak to the motion, but I do have an additional amendment, which is to add, and that the City of New Westminster approach the provincial government to pursue the possibility of a community healthcare pilot model for New Westminster. Okay,
is there a seconder to the amendment? Now, I'm just going to call the question on the amendment, not the original motion. All those in favor? Opposed? Carried. Councillor McAvoy.
Thank you, Your Worship. Well, I've been the city's representative for some time to the Fraser Health Municipal Advisory Group for the Fraser North area. And that group sort of discusses the state of healthcare in communities. Doesn't have a lot of power, but we get a hearing. And I'll tell you what we're hearing there and discussing the future of healthcare within our own city. We have a situation where doctors are retiring in large numbers. Doctors burn out. Doctors are retiring earlier than they used to. New doctors are not filling that gap. And the estimate at the last meeting was that New Westminster in the near future will need an additional 40 to 50 doctors. Not 4 to 5. That number flabbergasted me, but 40 to 50 additional doctors to serve New Westminster in the traditional model of general practitioner and 7-minute appointments and a once-a-year physical. So that's the kind of situation we're looking at in terms of how are we going to have effective healthcare in New Westminster. And the big part of that is having healthcare access for newcomers. So we do have the umbrella group in New Westminster, which works to address some of those gaps. But in those discussions at Fraser Health, it's acknowledged, they're not defensive about it, it's acknowledged that those gaps are very big in multicultural and multilingual communities, and that accessing a doctor and accessing a clinic for people who don't speak English, and if you're an immigrant to this country and you don't speak English or French, it means you're a refugee. And people who come with complex health problems as a result of those experiences and trying to have them addressed in a traditional model. We've also talked about the 140 languages that exist in New Westminster as a diversity in the city that needs to be addressed by the healthcare system. And we've talked about mental health and physical health. And the very first conversation under the new government occurred recently at one of those meetings. But there's been past conversations about how separate the mental health and physical health systems are, when so many people could use a place to go to deal with the combination of those effects on health, and be able to see a mental health practitioner and a physical health practitioner at the same time in the same kind of clinic setting is something that would tremendously benefit people. And I have a big dream, honestly, that, you know, when Tommy Douglas talked about having a complete healthcare system, that one day we will have a mental health care system that is equal to physical health. People don't understand when you get a mental health injury, you get a physical injury, you broke a leg. We understand that needs treatment. You should have a hospital to go to, you should have an ambulance that comes and picks you up. And some people might get well soon, some people might take a while, and some people might never be quite the same. We don't have that same system with mental health, and we don't have that same understanding for people who are dealing with mental health issues. And this kind of integration is something that becomes possible in community clinic, community health model systems. And I'm hoping that that's something that we can really work towards. Just one personal comment. Councillor Harper was the chair of the St. Mary's Health Coalition. I was the organizer. We didn't win. And we lost the institution that had a specific mandate for compassion as its primary means for determining how to deliver health care. That's not an official mandate of the public health system right now. I frankly would love the opportunity, still having those memories, I frankly would love the opportunity to put a lot of work into working for something positive out of the healthcare system, something new and something positive to come to New Westminster. I just think that would be utterly fantastic to work for something like that. And with the amendment and the motion in front of us, I think that we have some real potential working with our friends in the faculty, working with people in the community, as Councillor Puckmeyer mentioned, and working with the city and our local MLA, who happens to be a cabinet minister in the government, to really work and try to achieve something positive here.
Thank you very much, and thank you very much to our delegation this evening. I'm now going to call the question. All those in favor? Opposed? Carried. Thank you. Okay, our next speaker is Kathleen Langstroth.
Use my glasses. Kathleen Langstroth, President of the Queen's Park Residents Association. I'm just here to speak to the incentives and the tier system that has recently been introduced or finalized, I shouldn't say finalized, but the package has been put together that addresses the incentives and